Uterine fibroids are benign tumors of the uterus, and they are treated when they cause symptoms, typically of excessive bleeding or pain during the menstrual cycle. The standard treatment for many years has just been to advise patients to have a hysterectomy, which removes the whole uterus, takes it out, ends the menstrual cycle, and ends the symptoms associated with the menstrual cycle. Some women are opposed to that as they desire future childbirth, or they just want to avoid a major operation, which can have a significant recovery time of up to 6 weeks. Based on that, some less invasive treatments have been developed in the recent years. One of them would be uterine fibroid embolization, which is a procedure which deprives the fibroids of their blood supply, and any part of your body that doesn't have a blood supply can't survive, and the body essentially just slowly removes them over time. It's usually an outpatient procedure with a very short recovery time. It has a very high effectiveness of 92 to 95%, and very low in the way of complications. Other treatments available for uterine fibroids: if you have 1 or 2 fibroids and the primary issue is bleeding, sometimes your OBGYN can do what's called endometrial ablation, which is essentially removing the inside lining of the uterus. It doesn't do much in the way of getting rid of menstrual cramps, but it does get rid of the source of bleeding. If you're desiring future pregnancy, however, this is not an option for you, and it can have a relatively high rate of failure as the lining of the uterus can regrow. Other sort of focal treatments that have been developed for fibroids are, instead of doing a full hysterectomy, your doctor can do what's called a myomectomy, which is trying to take out the individual fibroids and then sewing back the uterus once they've been removed. It is the most commonly prescribed treatment for women who are strongly desiring future pregnancy. However, not all patients are candidates for it. If the fibroids are too numerous or too large, there's no uterus really to sew back together. An experimental treatment that has been used in several locations is using MRI guidance to take high energy ultrasound to really destroy the fibroids in a manner much like uterine artery embolization, where it actually kills the fibroids where they are and the body slowly resorbs them. Unfortunately, it has its limitations in terms of size and numbers of the fibroids, and it's only offered in several centers. And those are the treatments that are available at this time.